Hi everyone, today going to talk about the care of the elderly people. 1st October is celebrated as International Day of Older Persons. Now, staying physically and mentally healthy is important for all. Regardless of age, everyone should take care of their health. And why we should take care of the elderly? Because they are blessed with more wisdom, experience, gratitude, and strength. About one-fourth of patients over age 65 and half of persons older than 85 need help performing their basic activities of daily living, that is ADL, bathing, dressing, eating, transferring from bed to chair, continence, toileting, and instrumental activities of daily living, transportation, shopping, cooking, using the telephone, managing money, taking medications, house cleaning, laundry. So, whenever an elderly comes to an healthcare worker, he should make an assessment of all these ADLs and IDLs and question to detect weight loss, falls, incontinence, depressed mood, self-neglect, fear for personal safety, and common serious impairments, hearing, vision, cognition, and mobility. I have made this short presentation to actually see how we can help and how we understand all these topics. What is frailty? Clinically recognizable state of decreased reserve in older adults with increased vulnerability to acute stresses resulting from functional decline across multiple physiologic systems. Functional decline, progressive limitation in the ability to carry out basic functional activities. So what is the screening tool for frailty? Once the patient or an elderly person comes to the OPD, what are we going to ask? That, do you get easily fatigued? Resistance by yourself and without aid? Do you have any difficulty walking up to 10 steps without resting? You can even observe this as the patient walks into your OPD. Ambulation by yourself and without aid. Do you have any difficulty walking around several hundred yards? Illness, more than 5 kg loss of weight, greater than 5% loss of weight, then all, if you have anything like the question to more than 3 questions, if the answer is yes, then this is frailty. Okay, so more than 5 kg loss of weight, and pre-frailty if the answer is yes to 1 or 2 questions. Then another problem with the elderly is delirium. What is delirium? It is an acute and potentially reversible disturbance in cognition, attention, or level of consciousness. So you use the CAM method. Delirium can be 1 plus 2 or 3 or 4. If if the answer is yes, then you can have this, that yes, delirium is present, most likely present. What are the points? Acute onset, fluctuating course, inattention, disorganized thinking, and altered level of consciousness. So even 1 is present, 2 is present, 3 is present, or 4 are present, delirium is likely or confirmed. What are the differential diagnoses? It can be delirium, it can be dementia, it can be depression. So they have all overlapping cognitive changes. So what is the workup? Workup is not universal and it depends on possible causes based on history and physical examination. Drug, medication review. Patient may be taking some medicines which is causing this delirium, and maybe some infection, infarction, inflammation. So you should do a complete blood count, urine analysis, urine culture, blood culture, chest x-ray, ECG, cardiac markers, cardiac enzymes, metabolic, maybe electrolyte disturbances, vitamin B12, TSH, liver function test, or toxicology screen. Maybe he is taking some kind of harmful medicines or harmful substances by his own, because old people, they are obsessed with their own thoughts. So maybe he's taking something which is causing trouble to the cognition. Structural neurologic examination, CT head is required. Similarly, Now, how do we prevent this? Adequate optimal vision and hearing to support orientation, support appropriate eyewear and hearing aids. What happens if the patient is not able to take care of himself? He slowly develops delirium. Provide adequate nutrition, hydration, so that the patient is able to sit up in the chair and drink. Encourage regular mobilization to build and maintain strength and endurance. Avoid unnecessary medications and monitor for drug interactions. And even if the patient is not able to, even a full bladder can cause trigger delirium. So avoid bladder catheterization, ensure adequate sleep at night and wakefulness during the day. Because even bladder catheterization can cause infection, and encourage the patient to pass urine regularly. And if there is some UTI, then it needs to be treated. What is fall? Even the patient elderly are at high risk of fall. So once you are taking clinical history, you should see what are the symptoms which are what kind of fall it is. Is it because of lack of balance, loss of balance? So what was the reason? Previous fall, location of fall, activity at the time of fall. Was the patient in the bathroom? What's the patient doing some exercise? And time of fall, and whether there was any trauma to the patient when the patient has fallen down. So, what are the interventions? Again, multidisciplinary, multifactorial health, environmental risk assessment, and intervention program. If there is osteoarthritis, then you should encourage muscle strengthening. If there is a forward bending is there because of severe osteoarthritis. So you can ask the patient to do balance retraining, that's Tai Chi and group exercise program. Home hazard assessment and modification. You should have not have any loose rugs, tripping hazards. Then you should add shower bars, stair railing, improve lighting in the house. Then you should also prescribe vitamin D. Most of them have vitamin D low, and tapering or gradual discontinuation of psychotropic medications. They may be again causing the drowsiness in the morning. So you can taper the dose or discontinue if it is not required. You can look for postural hypertension. You can look for arrhythmia. You can do an ECG, heart rate and rhythm abnormalities. Check for cataract, footwear optimization. Footwear may be causing the patient to fall down because of lack of balance. And if there is edema, we can also use compression sore. Another problem of the elderly is malnutrition. The appetite becomes really less. So, what meal on wheel is a very small mnemonic with which we can find out why the elderly is becoming malnourished. Maybe some medicines which are causing loss of appetite, maybe emotional problem, maybe it is simple anorexia, it is a late life paranoia, it is something related to swallowing disorders, so that you can do an ENT assessment. Oral problems, the denture is creating problem, the person is not eating. Some kind of nosocomial infection, dementia related activity, hyperthyroid, hypercalcemia, hypoadrenalism. So these are the hormonal problems. For some enteric disorders, eating problem, low salt, low fat diet, the patient is not able to uh, take the diet because he doesn't find taste in it, or maybe he has a renal stone, a gallbladder stone, which is causing indigestion and he is not able to digest the food. Then another problem which normally the elderly face is constipation. And what are the common causes of constipation in geriatric population is primarily impaired colonic and anorectal function. Then there are many drugs. Then there may be diet he is taking, not taking adequate water. He is taking low fiber diet. He takes tea and toast, biscuits. He doesn't eat the food. He doesn't eat salads. Colorectal disorder, very important. You can go for endoscopy. There may be cancer, masses, stenosis, strictures, neurologic disorders, stroke, dementia, Parkinson's, autonomic neuropathy. They again can cause manifest as simply constipation, or they can be triggered by constipation. Psychiatric disorders, depression, anxiety. So your gut-brain axis is getting disturbed. Some drugs which can cause constipation is over-the-counter antihistaminics and NSAIDs. Many patients are eating too many analgesics, opioids, even tramadol can cause constipation, antipsychotics, tricyclic antidepressants. Many of them are taking many kind of imipramine or nortriptyline because of their neuropathic pains, anticholinergics, calcium channel blockers, diuretics, and iron and calcium supplements are also very common to cause constipation. So, what are the non-pharmacological treatment? We should ask the patient to increase the fiber in the diet, take adequate fluid, and as far as possible do physical activity. And what is the pharmacologic? Chronic laxative use should be discouraged. And you should review the medication regime, reduce the dosage, or maybe substitute. Now, this is a very busy slide. This is only to understand that the uh, elderly are normally on some kind of cognitive enhancers like donepezil, galantamine, or memantine, or rivastigmine, and they are also always taking some kind of laxative. So this will find normally in the prescription of the. And very important is to vaccinate your elders. So influenza vaccination, all elderly should be given annual influenza vaccination. Tdap to replace the next booster dose of TD for adults aged 19 to 64 years. TD has given every 10 years, one dose instead of TD, you can give Tdap. Hepatitis B vaccination in adults is recommended in high risk individuals and diabetic people who are more than 60 years of age. And we routinely recommend polysaccharide, pneumococcal polysaccharide vaccine for adults 65 years and older. So if this vaccine is received before the age of 65, then we have to give one dose at least 5 years after previous dose. Otherwise, this is a once in a lifetime vaccine. And conjugate pneumococcal conjugate vaccine is given in average risk individuals as per clinical decision in people who are more than 65, and a gap should be there between 13 and 23 for 1 year. So love and respect to your elders, avoid elder abuse. If you see it, you stop it, prevent it, and spend time with your elders. Thank you.